Dr. John Boone here, board certified ENT. I want to talk about getting ear drops from a bottle into the patient's ear and that experience. And I want my fellow ENT colleagues to start to consider, when you prescribe a medicine, is this a patient, is this a parent who can get drops in the ear? Does this patient, do they need an eardrop delivery device? Okay, so for an adult, so you just think, you picture Miss Smith, 85-year-old, maybe she has a spouse or partner at the home, maybe she's a widow, maybe she's single. What's her experience? Maybe she has rheumatoid arthritis, maybe she has glaucoma, maybe has some retina issues or some vision issues. How's Miss Smith? How are they going to get those drops in their ears? You bend your head over. So if Miss Smith has some back issues or shoulder issues or balance issues, how's she going to be able to do this? But then she has to count out 4 drops in her ear, or 5, or whatever. And then she has to make sure that the drops land in her ear canal. Okay, and then she has to keep her head on her side, as we all know, to allow the drops to go deeper into the ear. Okay, not as big of an issue if it's a swimmer's ear, otitis externa, dermatitis in the ear canal. A lot bigger of an issue if it's the middle ear. And if the drops have gotten here and Miss Smith sits up, drops start flowing out of the ear. Okay, so what an eardrop delivery device does, it makes that easy. So the ClearDropper is the only patented eardrop delivery device that can really tackle the issues that our patients deal with in a safe and low-cost manner. Whether drops are given out of an eye dropper or straight from the bottle, it's the same thing. The patient has to turn their head, they have to count them. So with the ClearDropper, you simply just put whatever mechanism in, and you count the drops. You go 1, 2, 3, 4. And so the patients can get the prescribed medicine in the drop delivery device. They don't have to count, they don't have to squeeze the bottle, no waste. So the next step, patient just simply puts their finger over the device. This is safe, it's medical grade silicone, it's not going to damage the ear, it's not going to cut the ear. You slide it in the ear. If a patient has otitis externa, a patient can slide this into the swollen edematous ear canal tissue. And actually, I've had many patients who I haven't had to prescribe an ear wick because the dropper will go past the swelling. And then simply, the patient can just turn their head to the side and squeeze. And you can see the medicines are out, the drops are in the ear. For your patients, elderly, for parents, it just makes life easier, super simple. And I'm gonna ask you from provider to provider, stop and think, can this patient, can this parent get drops in their ear? And if they can't get drops in the ear, the only way to help them out right now is the ClearDropper. Try it out. If you need samples, or if you need to purchase, ClearDropper.com.